Hi, everybody. Thanks for joining us. I am Drew Armstrong, the executive editor of Endpoints News, and welcome to Post Hoc Live. If you are joining us for the first time, hello. Post Hoc Live is our show that brings you the reporting, analysis, and the debate that usually happens behind the scenes in our newsroom. If you want to get alerts about future shows, make sure you're signed up for our Post Hoc newsletter. And you can do that by going over to endpoints.com. That is endpts.com. Then in the top right hand corner, you hit the profile link and then delivery and scroll down and you can activate Post Hoc. For those of you who are joining in YouTube today, you can use our live chat link to join the conversation and ask us questions. And if you're tuning in late, recordings will live on our YouTube channel. So let's talk about what's going on. We are streaming and recording this on May 13, the day after the White House's long-awaited most favored nation executive order on drug prices. If you are just catching up on this, the idea behind the order is like a lot of Trump's announcements. He's asking drug companies to cut their prices to match what they charge in a basket of other wealthy countries and then sell those prices directly to consumers in the US. That is the most favored nation part, the idea that the US should get the best prices or at least prices that are just as good. And if drug companies don't do that, the White House is threatening to force prices down using regulations and some other threats. So today we are going to talk about what that means, how it might actually work, all the many unknowns, and where the tricky parts of a policy like this are. Joining me today is Nick Shipley. Nick is the former chief advocacy officer for the Biotechnology Innovation Organization, which most of you probably know as BIO. In plain terms, that means he used to be biotech's top lobbyist in Washington. Now he runs his own shop, Cronus Consulting. He advises biotech and pharma companies on the fast-changing landscape in Washington. And just to cover any disclosures, obviously, Nick, you work for some of the companies that are affected by this order, and obviously they have a point of view here. Welcome to Post Talk Live, and thank you for joining us. I want to start with just spending a little time talking about how does this thing actually work? Because I feel like every time I, get involved in one of these announcements, whether it's Liberation Day with the tariffs or this with the, the most favored nation stuff, there's this process that you go through where, the White House does a call with reporters on background a lot of times. And then, there's a fact sheet that comes out and an announcement. And then you spend the next couple hours just trying to figure out okay, what does any of this actually mean? Because inevitably the language is a little bit thin. So what is your, just ground level assessment of what is the policy proposal here and what we know and what we don't know? And I realize that's probably a really long answer, so we can keep it basic to start, and then we'll start getting into all this stuff.
Yeah, I will do my best to keep it brief. So thanks for having me. Great talking to you again. You kind of hit the nail on the head. There is this build up period where Trump is posting on social media. There's a lot of articles in publications all across the landscape. Because an important thing to remember here is the Trump administration in their first term tried to execute a most favored nation program. It ultimately, didn't go anywhere. They launched it very late in the presidency, lost in court on procedural grounds. We can get into that. But it led to a lot of assumptions about what was in this most favored nation package. But we don't actually have a lot of those details here. When you said what is in here, what is in the actual text, the simple answer is not much. It's an executive order. Most executive orders, give directions to their agencies to then take several rulemaking steps. Even in that context, this is a pretty short. It's pretty skinny and pretty sparse on the details. Most of what you see here, there's some language about trying to get other nations to stop freeloading. This idea that other countries, and if you've heard Trump talk, you mentioned tariffs, really feels like the EU in particular are ripping us off. They're not paying for fair value. So there's a very short paragraph on that. There's just a one sentence section on getting some sort of direct to consumer sales going. That is not a model that by and large the biopharma industry engages in. If you think about how you purchase or fill a prescription, there's a lot of steps in between there, and that's just on you getting it, not on the purchasing and wholesaler side. And then there's the part we're all talking about here is this the establishing the most favored nations part. And even just the morning of, there were changes. The first executive orders that circulated had some different timelines in there that then also disappeared to get to final. So we don't even have a lot of dates that are certain here. What we do have is the administration kind of given itself some homework saying that within 30 days, they're going to basically tell pharmaceutical biotech companies what they believe is the most favored nation they should be charging and ask them to charge that instead of what they are
Right.
charging.
Yeah.
Um,
Yeah. All right. So there's a lot to
yeah.
unpack here. Yeah. Do we have a sense of who they're going to compare US prices against? I feel like I've seen, when we've talked with people about this in the industry or, version 1 point Trump 1.0 of this, it's some combination of like countries in Europe that feel like they have a relatively similar economic profile to us. I mean, it's, other wealthy nations, but like it's not like there's a list in this EO or anything like that.
No, this CEO doesn't have a list. You are correct. So if people want, you can still go on at least as of yesterday, you could still go on the CMS website and you could see the old MFN program. It was actually called IPI, the International Price Index was what they called it. It's still up there on their website. Just as a reminder to people, it applied to Medicare Part B as in boy, and it did have a list of countries. It wasn't just EU; it was kind of closer to an OECD list, which does have some not quite apples to apples comparisons. It's actually quite hard to get an apples to apples comparison. The U.S. is a very big country. Our economy is the biggest one in the world. Like there's not a
Right.
real true like parallel out
Yeah.
there.
There's not another just America sitting over in Europe that
Yeah,
looks
I
exactly like us.
mean,
Yeah.
and the pharmaceutical markets are also like, and healthcare markets in general are very different country to country. I mean, this is pretty well documented. A lot of different countries have very different health systems and how they pay, single payer, kind of hybrid versions like Singapore. And there are just countries that also that even though they're in the EU or we think of them as Western European countries, they are just in a different place economically. You include, I don't want to seem like I'm picking on any countries, but countries like Greece, who
Yeah.
I just went to Greece this summer, wonderful place. Really
Amazing. Yeah. But
encourage
it's a
everyone to
very,
go
yeah, it's just
there.
totally different economy and
It's
healthcare
very
system.
different. Yeah.
Yeah. Yeah.
So it skews the reference part.
Right. And then, there's this other part that I think I and a lot of other people have read with great interest. It talks about, I think like one of the big questions I had going into this was like, who is going to actually, like, who is the buyer here? Like if we say we're going to create most favored nation pricing, okay, like most favored for who? Is this for the government? Is this for private payers? And there's this language here, it's section 4 of the executive order. You can go to the White House site and read it yourself. It says enabling direct to consumer sales to American patients at the most favored nation price. And it says, to the extent consistent with the law, the Secretary of Health and Human Services shall facilitate direct to consumer purchasing programs for pharmaceutical manufacturers that sell their products to American patients at the most favored nation price. And like, I have a hard time reading that any other way than, saying the government is going to negotiate this and then you're going to be able to go and buy these drugs directly from the drug maker at whatever this reduced price is. And just before we get into all of the questions that raise, do you think I'm reading that right? And I realize I assume you know more than I do, but I don't know how much more.
I was going to say, like, if you're just reading this EO, you probably don't know much more than that because that section, it's literally just one sentence. It's a long sentence, but it's just there's just not a lot of detail there. My takeaway was it was like, ooh, they've been reading Mark Cuban's Twitter. He talks quite a bit about cost plus drugs and what it is, and he kind of implies that it's a direct to consumer product, but it's not direct to consumer for manufacturers. Even in that dynamic, his company, Cost Plus, is buying from manufacturers and then doing the kind of
Right.
distribution stuff. It's just there's so many questions about this kind of model. Like when you go to if you can't just walk into a Pfizer store and buy a Pfizer drug, you go to a doctor, you get a prescription, then you're going to CVS to get it filled. There are just different steps along the way that don't necessarily lend the same thing to getting on online and ordering a T-shirt
Yeah.
directly from the manufacturer. That's just not how healthcare works,
Right. Well, I
unfortunately.
mean, I know some of them have done stuff like this, like the diabetes, the insulin manufacturers now have their versions. I actually think Pfizer had they were setting up some kind of DTC thing, but to my recollection, a lot of this stuff is for a pretty narrow slice
Yeah,
of
none of it.
products.
Yeah,
Yeah.
I think
It's a lot
you're
of
going to the
lower
right point,
price
which is like,
stuff. Like we're not talking about like $100,000 cancer medicine, for example, here.
no. But one, none of those programs are set to scale. I think the diabetes ones you mentioned, which insulin is a fairly well-established, kind of therapy program, how we treat it, how we distribute insulin, that's fairly well established. But most of this is not just what's out there right now in direct to consumer world is not exactly designed for scale. And there are a lot of therapies that I just don't even know how you do it. You mentioned like a lot of most oncology cancer drugs, you're going to a clinic, you're getting this kind of the hospital outpatient setting, but you're still going to the provider
Right.
first. There are different cold chain requirements, things like that. There aren't many comparables to the insulin world where we're kind of distributing syringes of medicine all around to people all across the US.
Yeah. I mean, we can talk about how you might work through this, but I don't know. I think a conversation, admittedly somewhat flippant that I've had, but like if you're buying a, $50,000 a year drug or $100,000 a year drug, and that's been covered through your insurance previously, if you're a patient, and I don't mean to be dismissive of this idea, but like, you know, let's say they negotiate some 70% discount on a $100,000 a year drug. If that's a cash pay product, it's still $30,000 a year. I mean, I just can't imagine that there is a cash pay market for that. Maybe I can imagine a world in which, you know, an insurer is reimbursing after the fact somehow, or there's a financial arrangement for that. But like, it seems like it starts to get really complicated really, really quickly.
No, you're right. This industry is fundamentally not a cash pay industry. A million years ago, I represented Allergan. They were probably the closest to it when they were an independent company, and they had, Botox was for cosmetics was largely cash pay, but you didn't distribute that because that was botulism toxin. You still went to the doctor and they administered it.
Yeah.
So it's yeah, you are largely talking about like almost a supply chain. There's a physical, how do I get my drug chain? And then you've also got that financial chain running in parallel about how you reimburse and pay for it, which is then, where insurance and all that stuff comes in. I do think there's kind of a generous read that I think a lot of people want to have, and I do think could be positive, which is like, all right, maybe you're not exactly talking about like you, Drew, called up, Amgen or Merck and ordered your drug. But
Right.
you shrank out some of the levels of middlemen that are out there. And middlemen, if you watch the press conference where Trump announced this, he kind of
Yeah.
used that rhetoric quite a bit.
He hates
If
the
you hung
middleman.
out with
Yeah.
my friends in the pharma landscape in DC long enough, you've heard that rhetoric as well. But there are very legitimate policy efforts to say like, hey, like, do we have too many people in the middle of some of these chains just taking money out versus, kind of figuring out a way to shrink the cost down. They're like what also is happening yesterday was the text of the Republican reconciliation legislation was released. There were some provisions in there to attack PBM reform. That's very first steps of that legislation going through that process. But I think it is on people's mind. We've heard Trump talk about it. So I think there is a view of that particular section that says like, oh, he's setting the stage for PBM reform. What you can't get done legislatively, maybe you can get done from a
Right.
regulatory standpoint.
Okay. I mean, you're talking to a lot of people who would be presumably affected by this policy, if it gets implemented, and I assume there's going to be about 100 different lawsuits around this, and we'll talk about that in a minute. But like, what are the questions you're hearing from people in the industry about this right now, or the questions that you have? I mean, what's been the reaction to this over the last, I guess 24 hours at this point?
I think there's been a lot of reaction that I think is actually still based on the previous version of MFN. You're making the assumption about what MFN might look like, and you're saying, all right, most favored nation, that's a price control, is reference pricing. That is something that the industry historically has opposed. regardless of who's doing it. That was the origin of opposition to IRA largely, and they did sue during the first Trump administration about this. And like I said, we can get into some of that, but it has been a kind of an industry standard that, like, hey, if you want to grow an innovative industry, you have to let them have control of the launch price of their product. And we see that across a number of different industries. And it's been a long time since I took economics, and I certainly didn't get an advanced degree in it. But that's pretty standard stuff for growing innovative industries. You've got to let the market, particularly launch price, be something that those companies control and compete on, and have them innovate better and better products. And we've largely seen that in the U.S. It is kind of often talked about that we do spend more on health expenditures per capita versus some of these other countries, and that is true. There's no shortage of graphs showing that, but we are the crown jewel of all the innovative industry. It's so kind of interesting to hear Trump talk about wanting to compete with China on innovative industries, wanting to grow innovative industries. You want to have all this private investment and have it have this explosive growth. That's all great. But then you have this policy and MFN policy kind of come out on the other side. And I think you have a lot of people now looking at it saying, like, wait a minute, now you're going in the opposite direction now.
Yeah.
You're doing a price control to cram down on that innovation as opposed to like letting it bloom.
Well, I mean, and I think it's very interesting to see this policy come out not very long after we have had I know we were joking around about Liberation Day, but a tariff policy that was designed to force manufacturing to the US, and that we have seen a ton of different very big drug makers, commit by their tally, and like, you can dispute these tallies, but like tens of billions of dollars in new investment into the US and saying, we're going to build new factories here, we're going to do more manufacturing here. I mean, it's not that these policies are directly in conflict, but I want to get your take on this because it seems like, to me, on one hand, you're asking the industry to really play along with kind of one of their major domestic policy goals, in terms of bringing manufacturing back to the U.S. And then on the other hand, just a couple of weeks later, you've got this thing that the industry claims, hey, this is going to destroy our business model and make us flee the U.S. And I'm not quite sure how to read the grand strategy there to the extent that you think there is one.
Yeah, I'm not sure there is one. I'll be honest. It is, as you were just kind of painting the picture, it's a little bit mutually exclusive here. If the goal, as near as we can tell, when Trump does these press conferences, including yesterday when he was announcing the CEO, he does like to talk about the private investment, that he's setting this record for private investment. It is something he's clearly proud of, or thinks is politically very, very popular. And maybe it's a bit of both there. But I just cannot imagine a world where if the MFN part of this, the most favored nation, looks like it did in the first term, you're probably going to see companies start to say, hey, I don't, the policy environment has changed. I can't do this commitment of tens of billions, 20, 30, $40 billion of investment. And I do think, there was always, all these policies and what we think of, like the outcome for them on the tariff side in particular, whether they were driving the investment or they are truly bringing manufacturing back. I think that's all, can be a little bit debatable on the semantic level. But I think what is fundamental is if you take this policy on reference pricing and innovation and you use it to kind of cram down on these companies, they're obviously going to have less money to build new R&D facilities, build new manufacturing. I think, and what always stands out to me is the way not just the industry, but policymakers talk about taking this industry, from Europe. Europe used to be the center of innovative pharmaceuticals, innovative biotech, and it migrated to the U.S. as we had a better policy environment to foster that. And you're kind of, knocking the legs out from under that with some of these efforts. So I do think, especially if you listen to Trump and the way he talks about the EU, I'm just a little surprised that they don't recognize the kind of cognitive dissonance that's going on there.
What do you think the pharma and biotech public reaction is going to be here? And I ask that because like I talk to a lot of people in the industry. We talk to CEOs, we talk to executives, we talk to their comms teams, we talk to people in government, who are working on government issues. And I think, not unlike just about every other industry in the country, there's been, this the term kind of started, and we talked about this with people at JPM with a lot of optimism. We're going to do a ton of deals and they're going to deregulate and the markets are going to go crazy. And I think that for obvious reasons looks pretty naive now. I mean, I think you and I have joked, that like people thought they were getting Ronald Reagan. In fact, they're getting Bernie Sanders. Um, but still there's been a huge amount of caution and very limited willingness for anybody to stick their neck out in opposition. And I think, we've done some reporting indicating that like maybe that's starting to change a little bit. But like, what do you think the public facing or behind the scenes reaction to this stuff is going to be? Because like, we're starting to see some policies that I think if people were speaking freely or, in all candor, like if we had a Democrat in office, like the messaging and the actions would probably be very, very different than we're seeing from industry right now, especially some of the companies and lobbying groups that like control a lot of money and power to, maybe not mess with Trump in a way, but to screw with Republicans or make things difficult on the Hill and do things like that. Like, what's the reaction? Like, how should we be thinking about what we're going to hear or see or that might be going on behind the scenes over the next couple of weeks?
Yeah, I think on most favored nation in particular, I do think most of the people or kind of trade association stakeholders, have been at least, publicly on the record saying, hey, we oppose this.
Right.
And obviously in DC, there's, like oppose, and then there's like, we're opposing this. We're gonna, kind of blow things up. And there's a pretty large spectrum between those pieces there. I do think we have joked about it's not limited to the kind of biopharma sector. There's been a lot of hesitation around how you oppose this president. I think coming into this, there was this recognition that with Republican control of the House and Senate, there were fewer kind of like places for opposition to go. And I think the amount of, or lack, I should say, of oversight was self-evident. I do think people have been caught a little bit surprised by how willing the Republicans in Congress have they've been willing to go along with some policies, economically in particular, that Trump has put forth that would have been an anathema to them.
Right.
This is on tariffs, on reference pricing, price controls. I mean, it doesn't take a long Google search to find statements that the Republican leadership, the current Republican leadership, made about the Inflation Reduction Act. Which that was that's on the books. That's a law. We're kind of talking about this. There's a kind of a weird irony that the Democrats already, kind of did this last term, and it did result in a very, very tough political fight. I saw some comments from a couple of Democrats that are like, oh yeah, we're gonna get on board with this and we're gonna do, put this in a bill. I'm kind of politically stunned by that. It's like, you did the hard fight to do this already. Why are you validating his version of it? Why aren't you, defend yours? But that's a, different political fight. But I do think it is something that I think everyone's got to calibrate. Like you've tried to go along, you've tried to play nice. You didn't necessarily do the big public facing opposition because it wasn't maybe existential to your business model. I think this type of reference pricing, especially this latest EO, I should note, it does not indicate any limitations on Medicare Part B versus D or Medicaid. It's very wide open. Those are things that I do think everyone's got to kind of recalibrate around and maybe finally admit, like, there's no perfect administration. You're going to have to be able to voice some opposition here and not always be. This is an administration that has shown some willingness to go after some political retribution. So I understand the caution there. But big picture, you've also got to look at it and say, like, what kind of precedent or feedback loop are we setting for, when the cycle goes the other way and Democrats do kind of figure themselves out and get back a piece of the majority? Like, where are we suddenly going to have not, fought against these things that we also don't want them to do? You've got to have some policy bright lines that you quote unquote enforce. And that's going to be important.
How do you think we're gonna, I mean, I think one thing that I have learned to look for now and gotten in the habit of is like one of these policies comes out and then a few weeks go by and a couple of people, show up at the White House and announce deals or, there's a press conference or something like that. What do you think? And I realize I'm asking you to predict here, but like, what do you think if when we start seeing a company come forward and say, "Hey, we're going to do this," or like, what is that going to look like? Or is it just going to be like, screw this lawsuits, see you in court?
Yeah, well, I think maybe not quite the lawsuit part of it, but I do think, something that we've you and I have joked about with a lot of people, under this administration, today's headline is not tomorrow's headline.
Right.
So you're announcing one thing today, just a couple days later, Liberation Day, those tariffs lasted what, like 72 hours before you unilaterally paused
Right.
them. So if you'd been changing your business model based on that, that was probably bad practice. So I do think there is something to be said for the approach of like put your statements out there, making it clear you oppose this, and then pausing a beat and saying like, hey, okay, what do we want to do here? What's going to happen here? What's real here? Because the other thing, I'll come back to the beginning here, we don't actually have a lot of details in this EO about what this version of MFN looks like. It could be very broad. It could be very narrow. I mean, I will, I've got, the split screen with the original EO pulled up here. Section 5 is establishing the most favored nation pricing. It says the administration gave itself some homework first. They're supposed to go find these prices, give them to the companies and say, we hope you charge this. And then there's really not much. Like the line is like the secretary shall propose a rulemaking plan to impose most favored nation pricing. That's kind of it. The rest of
Yeah.
the EO is about importation, really. So there's really a lot of vagueness and room for details and policy. It would be very easy for them to come back and say like our rulemaking is what we did back in 2019 or 2020, whenever that was. It would equally be, they've left themselves space to do something totally different, especially, they have a series of meetings with executives, they find whatever accord they want. And, everyone kind of just forgets this because the other thing that's not in here over the course of yesterday morning, there's no deadlines. There's nothing that says that you have to have this rulemaking in 180 days anymore. That kind of fell out. It just kind of says if we don't get what we want, we will eventually move to this rulemaking plan.
Yeah. I'm not sure. I can't remember if you're a lawyer or not, but I presume, people have the first one of these went down in court, but I think on procedural grounds, if I remember.
Yeah,
Yeah.
I'm not a lawyer. I just play one on TV. But I mean that's always my view is like that's always what outside counsel for.
Yeah.
I was actually at Pharma, the pharmaceutical manufacturers, back in Trump's first term, and we did initiate litigation, but it was knocked out on procedural grounds. There's a law, the Administrative Procedures Act, that they were not compliant with, and if you do these sorts of things, you're in violation of it. And the Trump administration has not always been the best about honoring some of the finer details of administrative procedure. So I don't know if they'll run afoul of that again. We'll have to see. I'm sure anyone, company or association that's involved here is probably commissioning the various, firms around DC to do some analysis to see what's out there. I don't think that's going to be particularly surprising or shocking news, but that's just good due diligence. But it is something that did happen that, last time they did get it knocked out. So we haven't had any rulings on the merits of this, and maybe I know we're running up on time, but like it's worth mentioning. You'll probably see a lot of different references to people saying like, "Oh, it'll only be a demo project, only be a demo project." I think one thing that's important to note here is like when they did this last time, it was under CMMI, which is an agency under CMS. It was called a demo project, but it was still quite large. It was
Right.
in Part B. A demo project does not mean small by definition. That is actually one of the kind of like arguments in the underlying merits of the original case was what is a demo and what is CMMI's authority to do so. But I have seen a couple of people throwing around this idea of like, well, it'll just be a demo. It'll just be a demo. It's like, no, that's what CMMI has to call it when they launch one of their programs, but it can still be quite large, even nationwide.
Well, I'm sure we're going to be giving you a call or having you back on the show when we actually get a little more detail here. And I'm sorry that we are out of time, but this has been really interesting. So Nick Shipley, Kronos Consulting, thank you so much for joining us today. You're a friend of the newsroom and making me smarter every time I talk to you. So thanks for being with us. That is all the time we have for today, everybody. If you have a great idea for a future guest, tell me. The recording of this conversation will live on YouTube. If you have feedback about what we're doing, send me a note. I want to hear from you. And as a reminder, if you are already signed up for our post hoc email newsletter, you'll get notifications when we've got a new broadcast coming up. If you're not signed up, just head over to endpoints.com. That's endpts.com. Go to the top right-hand corner, hit the reader profile link, then preferences, and click to activate post hoc. You can also follow us on Twitter, X, LinkedIn, YouTube, and Blue Sky by searching for Endpoints News. Last but not least, thank you to our producer, Nicole Wetzman, and our engineer, Dalen Turk, who make this whole thing work behind the scenes. We will see you next time news breaks. For Post Hoc Live, I am Drew Armstrong.